Hi, everyone. Thanks for joining me today. I'm Mary Thyssen-Milder, and I'm with the Minnesota Department of Education. Today's topic for this presentation is to discuss the COVID-19 health and safety guidelines for youth sports and practices in Minnesota. So with that, let me share my screen. This presentation outlines prevention strategies identified in the Minnesota Department of Health's practice and games guidance for youth and adults to reduce the spread of COVID-19 during sports activities. At the time of this recording, the latest update was from January 14th of 2021. For the most current updates, once this presentation has been posted, go to the Minnesota Department of Health's COVID-19 website for information on sports during COVID-19. The presentation covers the requirements for holding athletic events, practices, games, scrimmages, and competitions, and outdoor recreational race events. It identifies important risk considerations, provides recommendations for slowing the spread during play, and what to do if a member of your team or organization has COVID-19. Lastly, it provides recommendations for team photography. All sports facilities, gyms, associations, sports clubs, and teams are required to develop a program-specific preparedness plan. The plan should identify an administrator and should include expectations around screening, face coverings, create protocols that are considerate of coaches, staff, players, and volunteers and participants at the highest risk of complications from COVID-19, as well as other prevention efforts. The plan must be communicated to officials, umpires, and trainers, and be available and accessible to participants, volunteers, and employees. Requirements for holding athletic events include following physical distancing. Maintain 6 feet between participants when they're not playing, or when they're on the bench or in the dugout or on the sideline. Maintain 6 feet between spectators or household groups. Allow only household groups to purchase tickets for adjacent seating in a single transaction. During any practice or competition, it is strongly recommended that spectators remain at least 12 feet away from the closest participant, meaning at least 12 feet from the field, the bench, or the court, whichever is closest. Follow guidance for the event setting. For example, there are guidance on events in the gymnasium or indoors or rinks or outdoors. Find the facility and guidance information on the MDH COVID-19 website for each type of venue. Do not exceed the number of people allowed in the venue. For games held indoors, if 12 feet cannot be maintained between the participants in the game, the athletes, coaches, student managers, timekeepers, and the spectators, participants must be included in the total capacity count. If spectators and participants in the game can be clearly separated by at least 12 feet, then participants in the game do not need to be included in the total capacity count. For practices, spectators and participants all contribute to the total capacity limit of the event space, regardless of the spacing between spectators and participants. Stagger game times to avoid crowding and congestion when spectators and participants are arriving, playing, and leaving. Post instructions for patrons throughout the venues at entrances and inform patrons not to enter if they're experiencing symptoms. Tell them what the venue's attendance limits are, what the requirements are to adhere to hygiene and social distancing, and to follow the venue's requirements for wearing face coverings. Encourage patrons and visitors to review a screening survey that checks for COVID-19 symptoms, close contacts with confirmed cases and quarantine cases, and out-of-state travel. Limit or don't allow concessions to minimize opportunities for crowding. Limit the size or don't allow bands, cheer squads, or other entertainment groups at the competition. It's strongly recommended that any bands, cheer squads, or other entertainment groups that are present at a competition remain at least 12 feet away from spectators and participants in the game. If bands, cheer squads, or other entertainment groups cannot maintain 12 feet of distance from the spectators and participants in the game, then the members of the band, cheer squads, and other entertainment groups must be included in the total spectator count. As of July 25th, 2020, per the governor's executive order, people in Minnesota will be required to wear a face covering in all indoor businesses and all public indoor spaces. As of January 2021, face coverings must be worn by all people in sports at all times, including practices and, when allowed, games, with the only following exceptions. During wrestling contact, a cloth face covering could become a choking or visual hazard and is discouraged. For gymnastics and cheerleading, if there are concerns about safety in regards to choking or the face covering getting caught on objects, athletes may temporarily remove the face covering during activities such as in tumbling, stunting, or flying, or on any certain apparatuses. However, athletes must wear face coverings for all other practices and routines. And for individuals who swim or dive or participate in water sports, they should not wear a cloth face covering while they are in the water. Continuing face covering exemptions. Individual sports performed outside that allow individuals to maintain distance from others at a lower risk of transmission of COVID-19. A cloth face covering is not necessary for athletes participating in outdoor individual sports if the athletes can stay at least 6 feet away from others. However, if social distancing cannot be maintained, athletes must wear face coverings. Note that even outdoor individual sports often involve occasional close contact with others, so teams and athletes will often need to modify the activity to ensure that 6 feet of social distance can be maintained. In addition, individual outdoor athletes are still required to wear a face covering when they are around teammates, coaches, or others, and not actively participating in the distance individual activity. For example, at an alpine or Nordic ski competition, a skier may remove their face covering for the duration of the competition if the competition is organized in a way that guarantees the skier will not come within 6 feet of others on the course, including when starting or finishing. In this situation, skiers would still need to wear face coverings before and after the competition. If a sport requires a helmet that interferes with wearing a face covering safely or effectively, which is more likely with younger children, athletes may consider alternatives to face coverings that are specifically designed by helmet manufacturers to provide protection against the splashes, sprays, and aerosols that can lead to COVID-19 transmission. For example, they could wear a full face shield. A face covering is still the most protective option and should be used to the extent possible, but a full face shield may provide some protection. Any face shield used as a face covering alternative must cover the entire face, extend to the ears and below the chin, and must not have exposed gaps or vents near the eyes, mouth, or nose. For further information on wearing face coverings during sports activities, see the guidance from the American Academy of Pediatrics COVID-19 Interim Guidance on Return to Sports, and also see the frequently asked questions about the requirement to wear face coverings at the Minnesota Department of Health's COVID-19 website. Face coverings must be worn in accordance with the MDH guidance and Executive Order 20-81. Types of face coverings can include a cloth mask, a neck gaiter, a scarf, a bandana, or a religious face covering. CDC recommends using 2 layers of fabric when making a cloth face covering. Face coverings that are made of thinner, single layer fabric, such as certain types of masks, scarves, neck gaiters, or bandanas, may not be as effective for blocking droplets that come out when speaking, coughing, or sneezing. It should not be used unless there are no alternatives. A face covering must cover the nose and mouth completely. The covering should not be overly tight or restrictive and should feel comfortable to wear. Any masks that incorporate a valve that is designed to facilitate easy exhaling, mesh masks, or masks with openings, holes, visible gaps in the designer material or vents are not sufficient face coverings because they allow droplets to be released from the mask. People are not permitted to remove their face coverings during activities that involve a high level of exertion. For guidance on when a person refuses to wear a face covering or is unable to wear a face covering due to a disability, medical, or mental health condition, please see frequently asked questions about the requirements to wear face coverings on the Minnesota Department of Health's website. Promote health checks. Create protocols to maintain health checks and screening of participants and staff and volunteers. Any staff, volunteers, or participants who are sick must stay home. Have policies for holding athletic events in place, outlining the process for those who become sick while participating in a sport. Be aware that persons can get a positive COVID-19 test even if they don't have any symptoms. Requirements for holding practices began January 4th of 2021 in this guidance document. Only practices were allowed from January 4th through January 13th. No games or scrimmages with other teams were allowed during that time period. Games and scrimmages with other teams started on January 14th. Follow the requirements for holding athletic events in the Minnesota Department of Health's COVID-19 sports guidance for youth and adults document. Spectator requirements are up to 1 spectator per participant is allowed to attend practices. However, spectators at practices are strongly discouraged. If necessary, for spectators to be at practice, ensure that spectators maintain at least 6 feet of social distancing between households and that they are complying with the venue or facility guidance, including applicable capacity limits. In terms of practice requirements, participants must maintain 6 feet of social distancing when not actively playing, when they're in team meetings or sidelines or waiting for a turn. Keep practices small in size. For youth and adult organized sport practices or training in non-game or competition activities, create pods. Pod sizes cannot exceed 25 people per pod, either inside or outside. A pod is a group of people that only practice or play with members of their own pod, which limits the potential for transmission in the event of exposure or outbreak. Teams and organizations are responsible for ensuring that members of different pods do not practice together, interact, or otherwise come into close contact while organized sports are occurring. Pods must either practice in physically separate rooms, facilities, or areas, or steps must be taken to ensure that pods are kept separated by a distance of no less than 12 feet at all times. Teams must also avoid reassigning athletes to different pods to the maximum extent possible. The smaller the pod size, the more the team can minimize broader transmission of COVID-19 among teammates. So teams are strongly encouraged to create pods that are smaller than the maximum of 25. Additional practice recommendations include start with skill development practices that allow participants to maintain social distance from members of other households for the first week or two of practice. This may help slow initial disease transmission on the team and ease participants back into practice for those who have not had much physical activity during the pause. Host practices outdoors if possible. Outdoors is safer than indoors. If indoors, minimize the time spent indoors as the risk of transmission increases with the more time spent there. Consider keeping indoor practices for 30 minutes or less. Avoid using locker rooms and facility showers. Carpooling should be discouraged as much as possible. In terms of spectator requirements, the total number of spectators at games must comply with the appropriate venue guidance and capacity limits. Strongly consider limiting spectators to 1 or 2 people per participant to minimize transmission and to comply with applicable venue guidance and capacity limits. Require advanced reservations and/or ticketing. For example, use online or app-based or email or will call. Do not allow walk-ins or impromptu purchases or admittance. Names, phone numbers, and emails should be collected as part of the reservations so that quick notifications can be done if an individual develops COVID-19. Schedule arrival times for longer than typical duration to minimize the congregation of patrons waiting. Establish staggered admission or entry times and durations to minimize overlap and congregating of patrons at choke points, for example, at access points, security checkpoints, admission areas, or concession areas. During a game, scrimmages, or competitions played indoors or outdoors, the number of participants allowed can include all of the people needed to make up a team. A team is defined as the total number of players, athletes, or coaches, referees, umpires, etc., needed to hold the game or competition as long as the total number of people does not exceed the total number allowed by the venue or facility. This includes cross-country and track teams. During a cross-country or track event, follow the course maximum, meaning the number of people allowed on the course at one time is 250 participants, or the total square footage of the course divided by 113, whichever is less. Participants must be divided into completely separated participant groups to ensure that the number of participants on the course at one time never exceeds the course maximum. Event participants must be further divided into pods and physically distanced, meaning 6 feet of distance is maintained between people from different households within the pods. For cross-country and track team events or competition, 4 teams of up to 7 athletes constitute a pod. MDH strongly recommends against holding tournaments or sporting events that will bring teams together from different states or from outside your local geographic area. If teams choose to host multi-team events, the following guidelines apply. If using locker rooms, allow only 1 team in a locker room at any one time and limit the amount of time in the locker room. Teams can only be at a facility while they're playing a game. Teams should only arrive early enough to warm up before their competition, and teams should leave as soon as their game is over. The venue capacity requirements must be followed. Recommendations for multi-team events and tournaments: consider limiting or not allowing entertainment, including bands, cheer squads, or dance teams at this time. Strongly consider limiting spectators to 1 to 2 people per participant to minimize transmission and to comply with applicable venue guidance and capacity limits. Limit the number of participants as much as possible, as well as minimize the number of parents or chaperones that travel with a team. Remember that if an individual tests positive for COVID-19 and was traveling with others in a vehicle for greater than 30 minutes, it could result in quarantine of everyone who traveled with that person in the same vehicle. It could have been in a bus, a van, or an SUV. Avoid overnight stays as much as possible. Consider hosting events at a central location that does not require teams to stay overnight. Remember that staying at hotels can create another environment where teammates gather in close proximity, which increases the risk of transmission. This guidance outlines the requirements for holding organized recreational race events, for example, run or walk races, triathlons, bicycle races, or cross country skiing during the COVID-19 pandemic. Unless this guidance imposes a different or additional requirement, any organized race event must also follow the requirements in other sections identified in the guidance document. Certain race events may have spectators, and any event with spectators must follow the requirement of the Stay Safe guidance for entertainment and meeting venues with respect to how many spectators are allowed and the steps that must be taken to protect the health and safety of spectators and workers or volunteers. The individual or entity responsible for organizing the race must incorporate applicable requirements for these guidance documents into the COVID-19 preparedness plan for the event. An organized race plan includes key elements in order to prevent COVID-19 transmission at an organized race, to maintain control over the event, and to facilitate social distancing between participants, volunteers, and employees. Registration must occur prior to the race through online or other contactless methods. Any racing equipment, promotional products or handouts, bibs, etc., should be mailed to the participants prior to the race day. The number of participants allowed on the race course at any time depends on the size and structure of the course. Participants must be divided into completely separated participant groups to ensure the number of participants on the course at one time never exceeds the course maximum. Further, races that choose to exceed the course maximum must ensure an entire participant group has completely finished the race and vacated the course before releasing a new group of participants. Workers are not counted towards the course maximum for the purpose of this guidance. Event participants must be further divided into pods of no more than 25 individuals and socially distanced, meaning 6 feet of distance is maintained between people from different households within pods. Each pod is released in a staggered manner to avoid clustering on the course and intermixing of pods. As each pod is released, individual participants should also be released in a staggered manner or positioned to allow for proper social distancing within the pod. Participants must maintain social distancing from other participants, volunteers, and employees through the entire event, including at the starting line, throughout the race, and at the finish line. Staff and volunteers must also maintain social distancing from other staff, volunteers, and participants. Social distancing measures should take into account the size and structure of the venue. For example, if the race takes place on a track, lanes should be designated according to pace. For example, with slower participants in outside lanes and faster participants in inside lanes. Markers such as tape, traffic cones, or stickers should be placed on the ground to aid participants in maintaining social distancing. Participants should be given staggered arrival times based on their pod's start time to avoid congregating at the starting line. Participants within the same pod should be spaced at the starting line in a manner that allows them to maintain social distancing from each other. Participants must immediately leave the course after finishing the race, and employees and volunteers must ensure that participants do not loiter or gather in groups at the finish area. If a race event is shorter than a half marathon in length and is not being held in a venue with a defined perimeter, the event must not set up seating or other areas that will encourage congestion of spectators. Any persons who do watch the race must adhere to social gathering. Secluded courses like roads or trails or parks in areas with low foot or road traffic congestion are preferred to discourage attracting crowds. If the race is held in a defined outdoor venue, for example, at a track at a public school or in a stadium, spectators are permitted, but the venue must follow the capacity limitations and all other requirements outlined in the preparedness plan requirement guidance. It's important to consider the level of contact in a sport. Before starting games in a sport, consider the risk associated with that sport in terms of COVID-19 spread between players. The more physical or close contact occurs, the greater the risk of spreading the illness. A sport or training that takes place indoors is riskier than if the activity is done outdoors. Important risk considerations that should be considered before a team travel include there may be increased risk of COVID-19 when participating in a game or tournament, and COVID-19 activity may be different in the different regions of the state, also contributing to a possible increase in risk. Traveling out of state to participate in sports activities is strongly discouraged. However, if teams are considering traveling to other regions or states for games, they should be aware of the COVID-19 activity to inform their decisions. MDH recommends the following for slowing the spread of COVID-19 during play. Consider whether contact in the sport can be modified. For example, can contact be reduced among players during practice and even during games in order to eliminate close contact? Consider whether practices or games can occur outside, as in general, being outside reduces the risk of COVID-19 transmission. Minimize sharing of objects. Do not share individual water bottles, community snacks, or towels. Encourage the use of dedicated personal equipment such as bats, mitts, brackets, etc. For coaches, adults, and athletes and parents and spectators, if a case of COVID-19 is reported to you, notify MDH by email. MDH will be available to answer questions you have and can provide guidance. MDH also has a template notification letter for close contacts or others on the team who may have questions about their risk of COVID-19. Once you hear of a case on your team, the team association's COVID-19 contact and our coach must review whether or not the case was infectious while with their teammates and whether or not an exposure occurred. The COVID-19 contact and our coach can consult with MDH or their affiliated association to discuss exposure assessment and other concerns. It's important to keep rosters of who was at practices and, when allowed, games each day so contact tracing can be done quickly. Continuing the conversation about what to do if a member of your team gets COVID-19. A 14-day quarantine is recommended for people who have been exposed to COVID-19. In some circumstances, a shortened quarantine period may be possible. People who are sick with COVID-19 will need to stay out for 10 days from symptom onset. For more information on what to do if a player who is symptomatic can be found on the COVID-19 decision tree for people in schools, youth, and childcare programs on the MDH website. Regarding team photography, standing close together is a high-risk activity, even when it's a shorter period of time. Consider taking individual photos and using editing software to combine them in a group photo. Consider using a longer lens to increase distance between the photography staff and the people being photographed. Group photos should be taken outside if at all possible. If indoors, use a space where people can be separated to allow for as much social distancing as possible. Prepare for the photos before people arrive. For example, identify the site, i.e. if they're in the bleachers or on the floor, and pre-mark the spots where people should stand for a group photo to minimize group crowding together while coming into the area. People should face forward in the same direction. People should wear masks as they get into position. Keep the mask on until the photographer provides a command to remove the masks and take a picture. Time without masks should be very brief. People should replace their masks as soon as the photos are done. When the photo has been taken, people should quickly separate from others. This presentation outlined prevention strategies identified in the Minnesota Department of Health's Practice and Games Guidance for youth and adults to reduce the spread of COVID-19 during sports activities. At the time of this recording, the latest update was from January 14th, 2021. For the most current updates, once this presentation has been posted, go to the Minnesota Department of Health's COVID-19 website for information on sports during COVID-19. I appreciate you attending and listening today. I wish you the best in your sports activities. Be safe and healthy in your gameplay. Thanks and have a great day.